Hi y'all, thank you so much for all of the interest and the questions on our Instagram post leading up to our open house. There were so many that we decided this might be an easier way to answer your questions. Just do a little Q&A. So,
here we go.
Here I go. First one was, I'm going to give to you, consultation. What can I expect when I come in for that?
So guys, when y'all make a consultation with us, it starts before you even get here. When you fill out your medical history, Alex and I will review that with Dr. Taylor. We're wanting to make sure that you're a good candidate for any procedures that you're coming into. When you actually show up for your consultation, there's a lot that goes into that. We're going to spend an hour with you discussing your concerns, what your treatment options are. We're going to have you take some before pictures and go over those. Let us know what your concerns are. But in addition to that, we're also going to give you a full face assessment. We're going to measure the proportions. We call that the phi assessment. We're going to make sure not only are we treating lines and wrinkles, but we're making sure that you have a proportionate face, because we know a proportionate face is a pretty face. Mm-hmm. But we will discuss your treatment options. We'll actually develop an individualized treatment plan for you. You are going to collaborate with that. How much money do you want to invest in this? How much time, how frequently do you want to come in for your treatments?
Your treatment plan is not going to look like your friend's treatment plan. Everybody's is different. It's customized.
Yes.
And so many times we see people come in and well, my friend only had to have one syringe. Why are you telling me I need two? Your friend's face is different than your face. We're all different. So next question, as a first-time Botoxer, what do I need to know beforehand? Take this one. First of all, you want to stay away from alcohol, aspirin, ibuprofen, all those blood thinners for a few days before your procedure, mainly because that's going to help prevent some bruising. Can bruising still happen?
Yes.
Yeah, it can still happen. But that helps your odds of not getting a bruise. And two, if you're an exerciser, do your exercise before you come in, because we don't want you to exercise after. What else? Don't plan a massage. Don't plan a facial for after you get your Botox. But the next day, everything goes back to normal.
Yep.
What's the best treatment for under eye bags?
That's a loaded question, and there's not a one-size answer that fits all, because we are all uniquely different in our under eye area. We are going to recommend that you come in for a consultation for this. A lot of people think Botox will fix everything, and under eye bags is a whole different ball game. It can be your fat pads have herniated out. That's going to require surgery. It could be just that the texture of the skin is poor, or we've just lost some volume with natural aging, and that's going to require fillers. There are so many different treatment options. Dark skin underneath the eye. Some people think that Botox and fillers can help that, and it might be just a pigmentation issue that our estheticians can help you with. So again, that's why that consultation is really important, so we can give you your best treatment options.
Which neurotoxin would you recommend, or which one is best for the masseter muscle? Masseter muscle, it's this muscle. It's the one that's responsible for clenching your teeth, grinding your teeth.
A lot of people grind their teeth at night. But it also can make the face look a little bit wider. So that's why people ask what's the best toxin treatment for that area, because it can diminish the ability of that muscle to squeeze as much and actually get bigger. It's going to the gym every day, so he's getting bigger on a lot of people. So we want to tame that down a little bit. I'll say this, even for glabella, frown lines, crow's feet, I don't think there's any one toxin that is better than all the rest, okay? The end game is still the same. It's gonna keep those muscles from contracting. Some have been around a little bit longer, some claim that they last longer, some say they set in faster, but ultimately, it's gonna stop that muscle from contracting. But another thing that a lot of people don't think about, they're like, well, I used this treatment and it only lasted 2 months. There are a lot of other variable factors that you have to consider too. The injector placement is one. The dose. Someone might get 50 units, someone might get 10. I guarantee you the person who got 50 is going to have a better result than someone who squeaked by with 10.
And it's going to last them longer.
Right. So there's a lot of variable factors there. So I'm not going to say anyone is better than the other.
Nope.
No.
How early should I book for the holiday season? Now? Now.
Well, I'll be honest. Like we said in our consultation, we set up a treatment plan. Most of my clients come in 3 to 4 times a year. So they're coming in June, July, and August. They've already booked their appointment. They're already going to be holiday ready. But if you've fell behind the wagon, or you didn't make your appointment, or you're just thinking, I want to look good for my holiday pictures, now is the time. I typically tell my clients between October 1st and then right before Thanksgiving is your best time to be holiday ready, because most toxins will last 3 to 4 months. So you're good through Thanksgiving, Christmas, and the New Year's, and you don't have to worry about your toxin wearing off. Also, if you schedule in that October to November before Thanksgiving, most pictures happen at Thanksgiving or around the Christmas time, or you got Christmas parties. If you're going to do fillers, you might bruise a little bit. So I also tell people that October to November is the prime time to get their stuff done.
Perfect. Should you do Botox one treatment session, your next treatment session maybe do Dysport, so that you do not become immune to a neuromodulator? What do you think about that?
So I've been doing this a long time, guys. We're looking at about 30 years. I started off with Botox when it was the only one available. So I will be honest, the majority of my clients do Botox. It's not broken. We're not trying to fix it. I mean, they have great results, so there's no reason for me to switch. But then sometimes people say, I just don't feel like my toxin is lasting as long. So here's something that I consider. Number one, how many units am I using on these people? We started a long time ago, so we really didn't have a clear-cut recommended amount of units for treating in between the eyes, the forehead, and the crow's feet. I might have put 40 units in those people, and the recommended dose is 64. I also started those people when they were in their 30s, and they are close to 60 now. So a lot of things have changed on their face. They've aged from the sun. They've just lost volume from aging. So can I tell my story about the?
Yeah.
Okay.
Yeah.
I tell all my
I think
clients.
you should.
I tell all my clients this, and it kind of helps them. It makes sense. Your skin and your muscles play tug of war all your life. When you were younger, it was an even playing field. No one was winning. But then we hit our 30s and 40s, and we start losing some fat, we start losing some bone structure, and then all of a sudden we start getting some crow's feet, we start getting the frown lines, and guess what? Those muscles are winning the tug of war game, and they're causing that skin to crease. So oftentimes we'll use a toxin to actually decrease or make that muscle less strong to be like the skin. It's kind of weak. But there's going to come a time when that doesn't do the trick anymore. And you have to start thinking about strengthening the skin to be strong like the muscles. And that's where your fillers are going to come in. I love that story. I just think it makes sense for people. I don't even remember what the question was, but I got to say that.
All right. So when do you expect to have access to the new tox? Well, Jeuveau was kind of labeled.
It's labeled the new tox.
The new tox.
And we already have it.
We've had it a long time.
Yeah.
It's a great product. Love it. The next one is Daxi, and it's the one that is supposed to last up to 6 months.
6 months or greater is what they're claiming.
And that one, it comes out the end of the year.
So it got its FDA approval, but there's a lot, once something gets approved, you got to train everybody on it. So you'll see it as early as December, but most likely the first quarter of 2023.
Very good. And let's see, how long does it take for a tox to take effect? Usually it takes 3 to 4 days before you start noticing it, and then 7 days to 12 days is when it pretty much sets in.
Yeah, I just say 2 weeks for maximum effects. I have some clients that swear it happens in 24 hours, but typically you should see your effects by that 2-week period. And how long does it last?
That varies from person to person, but typically 3 to 4 months.
On average. Now, we had some questions about people who work out. Okay, they tend to burn through a lot of things. They can burn through fillers and they can burn through toxins. One of the first things that I do if a toxin doesn't last at least 3 months on them, I evaluate a couple of things. Number one, my placement. I always look at me first before I look at the product. I look at the dosage that I'm using, and am I giving them enough units? Am I giving them a fair shot to get the results that they're looking for? So those are some of the main things that I'm looking at. And then there's the dilution factor. The higher concentrate doesn't spread as much. A more dilute tends to spread more. There's a lot of variables that, again, you don't know as a consumer, but these are things that we're hoping to educate you that can affect why did mine not last as long. And sometimes, you know, guys, we just don't have an answer. My athletes, God love them. I mean, you look great, but your toxin sometimes doesn't last as long.
True.
Just that's the nature of it. So, but sometimes we don't have an answer.
Okay. And what areas can be treated with Botox? On label or off label?
Let's give them all.
All
Well,
of
you know, that's an important thing to talk about. Did you know that Botox is the only one that's FDA approved and studied for 3 areas of the face? Frown lines, forehead, and crow's feet. Now, do we use other toxins in those areas? Yes, but those companies haven't actually studied it, but it doesn't mean they don't work in those areas. With that being said, we use all toxins in several other places on the face. So we can, we'll move our way down. So.
All the way down.
First one is here, the little bunny lines or wolf lines when people scrunch up their nose or they have lines on their nose. You can pick another one.
Chin. The mentalis muscle, the one that causes us to dimple up. I can't do it right now.
Some people have a gummy smile, so their muscles are so strong in this muscle right here that it pulls their lip up, and whenever they smile, you see a lot of their gums. So we can put just a small amount of Botox right there to relax that muscle so you can't see as much of their gums.
Lip flip. And a lip flip is great, I mean, but it doesn't last very long.
Yeah.
It's a quickie.
Do you think it's because we use less units?
Could be.
You got to use your mouth for other things, so we can't knock it completely out. We want to just soften that action, but that's what I find my clients saying. It doesn't last as long, but they like the result, and they're not quite ready for fillers. It gives their lip a little bit of elevation, but also lip lines, smoker's lines. These right here. So, but that's all treating the same muscle. All right, am I next or you? Oh, yeah, I did gummy smile. No, you did lip flip.
I did lip flip. You do.
All right, masseters. All right, those are for the people who grind their teeth. They also tend to have a more square shape. And this is part when we do an assessment, we're looking at your facial shape. Just another thing that we do. We're not just looking at lines and wrinkles, but if this is very large, someone has a square face. And so I want to thin their face. I want to give them this triangle of youth. If you sat in my chair, you've heard that. I want to slim their jawline right here, so we'll put some Botox into here. It also saves their teeth. If you grind, you're wearing down your teeth, so that's another benefit. Oh, there's more.
Okay, how about platysmal bands?
Yes.
Platysmal bands.
I can show you what they look like.
Yeah.
I'm immune to toxin, so all of my muscles move.
Why are you immune to toxin?
I think that part of it is I did it for 30 years. I became immune 15 years after doing Botox. But back in the day, there was no regulation or like say, don't get it injected more frequently than every 90 days. We injected it a lot, people. It's like, I have a wrinkle, I'll use it. So I think the frequent exposure, our bodies are very intelligent. I think my body said, hey, she's exposing herself to this. We need to protect her. And so I have not been tested for antibodies, but no toxin works on me. I've even put 100 units of Botox right in through here. No nada. Average unit's 20. So that just goes to show, I mean, I could probably eat a can of botulism and be fine.
And be just fine. You
But
can
I can show you what platysmal bands look like.
Okay, it's these guys right here. And we can take a hold of those and inject all through here to help relax that. And also when you come up along here, you get a nice little bit of a lift through there.
We forgot about the depressors.
The depressors right here. So you don't pull down, and it helps relax, and it helps the corners of the mouth.
You'll just love these faces.
We make you make them.
Yeah.
We have to make them.
So you get to see us. We do it too.
Yep.
There's one other thing.
Yeah.
It's off label, but for pores,
Yes.
we can sometimes do little micro deposits of Botox right at the surface. Sometimes I do it for crepey texture of a neck.
And the décolleté.
I really like to go more skincare routes with that. I feel that gives you a more long-term.
Effect.
The Botox are, again, 3 to 4 months. And so when we start loading ourselves up all over here, I mean, it can add up and cost. Not to
Quickly.
say that it doesn't give us a good result, but we're all not made of money, so we want to be a good stewards of your money, and protecting your skin and getting on a good skincare regimen is something that's going to protect your investment with Botox and fillers and surgeries and anything else that you do. That's it for now.
For now, but we'll be watching for more questions. So if you have any, throw them out there.
Bye.